Hi, in today's video I'm going to talk about a very small but a significant aspect of OET speaking role play cards. Very often you found these images, the brackets in a role play card. You have words between these brackets. Now in this video I'm going to discuss whether you should actually be using those words and sentences given in the brackets. If yes, how should you be using them? So let's look at a couple of role play cards and then discuss how we can use the words given in brackets in our speaking. So here on screen we have a first sample. The setting here is patient's home. And we're looking at a nurse's sample. Now, once we have the background information here, if you look at the task, we have a list of tasks given here. And let's just look at the brackets for now. Here we can identify a bracket. And what does the task say? It says, reassure the spouse about his or her situation. Example, doing all he or she can, caring and working full-time, difficult, etc. Now there's another bracket here. Give assessment of patient, now constant monitoring necessary, round-the-clock assistance, etc. If you look at the bracket given here, what does it say? Advice on choosing nursing home. Example, list of requirements, visiting different options, speaking to staff, residents, etc. So when you have these many words or sentences given in a bracket, should you really be using them? Let's look at another card. The setting here is clinic, and of course this is again a nurse's card. Now here we can see the bracket in the first task itself. Confirm reason for visit, and it says removal of stitches, wound cleaning, redressing, etc. Another bracket over here, let's look at this one. Give information about squamous cell carcinoma. Bracket, it says type of skin cancer caused by sun exposure, ultraviolet radiation, etc. Or for instance, if you look at this bracket here, of patient skin monitoring, example, checking for new changing spots, regular doctor checkups. We have one here, keeping wound clean, covered, dry. Now, let me tell you, very often what students do is read out things given in the brackets as it is. For instance, if you look at the last task here and it says advice on aftercare. Okay, so if I'm the candidate, the nurse, I would be saying, okay, I'd like to talk about aftercare. Make sure you're keeping the wound clean, covered and dry. So what did I do here? I read the words in the bracket as given. Or if you look at this particular task, I might read saying, it's important to monitor your skin, like checking for new or changing spots, regular checkups with doctor, etc. Now remember, your OET speaking and the role play card is to check your speaking proficiency. This isn't a reading test. So there's no point in reading out everything you see in brackets. So the billion-dollar question is, what do you do with these words or sentences then? Should you ignore them altogether? Well, I would say no. Number one, these words in brackets are to assist you. So these are kind of prompts given so that you will be able to develop that particular idea and speak. And because they are prompts, there is nothing mandatory that you have to use everything given in the brackets. But if you are using the words in the brackets, try not to read them out. Did you get what I'm saying? Well, don't worry. Let's take an example and discuss this further. Now, this is a replicated speaking question of the November 30th exam, and here The setting is an emergency department. So the nurse is seeing a 36-year-old patient who was bitten by a snake, and as a nurse you're assessing this patient. If you look at the second task here, it says find out more details about the snake bite. So yes, after establishing the reason the patient is there and taking the basic details, okay, I can see a wound on your hand, so I know you're here for some assistance regarding that. Can you tell me what exactly happened? And then the patient says, oh yes nurse, I was bitten by a snake when I was on a camping trip with my family and so on. And then we go on to the second task, and it says find out more details about the snake. Now the patient just said that he or she was bitten by a snake, it was a camping trip, and nothing more about the snake. So our task says find out more about the snake. And because we have words in the bracket, students tend to read it out saying, can you please tell me more about the snake? Like the type, the appearance of the snake, the severity of the pain, any treatment, etc. Don't do that. What else should you be doing? Okay, now first thing is to decide whether you should be using all the words given there. Okay, so pick out words that you are planning to use in your sentences. Number 2, if you've picked out words, try not to read them as given. Instead, see if you can paraphrase them. Number 3, try not to say it at a stretch. If it requires breaking down into chunks, do that. For instance, I might first say that I want to know a little bit more about the snake bite. Can we discuss this further? Then, when the patient says yes, I ask, can you tell me a bit about the snake first? Did you see the snake? Do you remember anything about any marks on the skin of the snake or the color? See, here it says type and appearance of the snake. But did I exactly use the words type and appearance? Instead I say, did you notice any marks or the color of the snake? The same thing in my own words. And I was not even reading it at a stretch, right? First I spoke about the snake, and once I get the response, I go to the next half, which is the severity of the pain and any treatment that was taken. So once the patient describes a snake, I go ahead not to the next task, but to the remaining aspect in that same task, saying, okay, I would also like to know a bit about how severe your pain is. Do you feel extreme pain, or would you rate it somewhere at a 3 or 4, which means it's bearable pain? See, I've taken the help of the words there, severity of pain, but I chose to express it using my own words and ideas. And that is exactly how you should be using the words or sentences given in the bracket. Now, here is a challenge for all of you. Let's look at, let's choose this one, the last task, which says resist request for pain relief, encourage the patient to keep calm and still, that is minimize spread of venom through lymphatic system, and may mask symptoms of bite wound to be assessed first. So here is an open challenge. I want to see how many of you can come up with samples using this particular task and write down sentences using the words given in the bracket, but try to make it in your own words or paraphrase them. Let's see what interesting responses come up. If you would like to participate in this challenge, all you need to do is type out your responses in the comment box. Thank you.
Medcity International Academy. Trusted hands forever.